do have a lot of nurse practitioners that are a little bit burnt out from being nurse practitioners, and they want to now work as RNs again remotely. Some of them will work remotely as an NP, but a lot of them want to do utilization review or care or case management remotely and use their RN again and not their NP. And so I have people coming to me like that. They're just seeing, they're working as an NP, maybe in primary care or family practice. They're seeing way too many patients per day. And after X amount of years, they're like, maybe I'll go use my RN license and take utilization review from Marie. So I teach utilization review also. We teach, we have a diabetes course, diabetes health coaching.
So let's talk about your first, one of your first courses that I have here, utilization review. Can you talk a little bit more about what utilization review is? What might a typical day look like, and what are some tasks a nurse might do?
Utilization review and utilization management. They're nurses that usually work behind the scenes. They could be case managers where they're doing a lot of the case management, such as talking to the patients in between from the doctor's office, or talking to patients that have been injured, those kind of things. Talking to patients that are being discharged from the hospital, but also utilization review people. They work behind the scenes to determine or help to determine, who needs a certain surgery. Well, the doctor determines you need the surgery, but then the utilization review or risk management person gets a bunch of cases together, and they get case files. And they have to look at these files. There might be 18 a day that they have to go through, and they have to make determinations on, does this person, like, say they need a certain drug, a special, high-tech IV drug, or maybe they need a knee surgery, or, whatever it may be. Is it a pre-authorization? Is it a pre-certification? What is this? So they have to look at the case. They have to determine if the case, I got a couple little notes here. They have to determine the risk of the case. They have to go into either the pre-certification, the authorizations, they have 24 hours to sometimes a 14-day turnaround for these types of cases that they have to look at. So many times you might only have a 24-hour turnaround. Other times you might have a case where you're working on it. You go back and forth with the doctor or the office, trying to get more information to determine, does this person's policy show that they have such and such available to them? So it's not always just, do they need this medicine, but does the policy cover it? And then you have to look to see if all the determinations are made in regards to, basic medical care. If someone is in a certain situation, do they need X, Y, and Z? Do they require the knee surgery inpatient, overnight? Can they do outpatient? Has the physician done X, Y, and Z to determine that, yes, now we're ready, for this type of surgery or this type of medication or procedure? So that's what a utilization review nurse does. They work behind the scenes, but some of them can also work with the patients. It depends. There's so many different areas. There's concurrent review, there's retrospective review, there's prior authorizations, there's pre-certifications. I mean, there's just a huge area. So nurses will say to me, I want a job where I don't have to speak to anybody. And I'm like, well, utilization review, sometimes you might not speak to anyone. Other times you might speak 50% of the day to the doctor's offices and 50% behind the scenes. It depends on what kind of utilization review they get into. So, I could go on and on about utilization review, but it's basically not talking much to the patients, working behind the scenes.
So are there certain specialties that are best suited for utilization review?
Not really. Everybody needs risk management and utilization review. Every specialty and non-specialty. Now, The specialties that pay the most, which is shocking, but like I can take an LPN that's done, home health, or they've done long-term care, rehabilitation, maybe doctor's office or hospital. RN, they could be an OR nurse, they could be med-surg, they could be home health, they could be long-term care. I mean, whatever. But the specialties that are in the most demand, psych and behavioral health for utilization review, and they pay the most. And that is because not enough psych and behavioral health nurses want to work behind the scenes doing utilization review. Because if you get into psych and behavioral health, you're going to be a talker. You're going to be with your patients. So I have a lot of psych and behavioral health nurses that love taking the utilization review course from me. They learn the basics, and many companies will say they want 1 year or 2 years experience in utilization review, but with my course, they usually count it as towards 1 year experience already taking my course. A lot of companies. And then there's other companies that might say they prefer you have utilization review experience, but they don't require it. The other specialty that we don't get enough of is oncology nurses. We just don't. I mean, there's so much utilization review for oncology nurses, transplant nurses, and the kidney transplant or like bone marrow transplant, people like that, transplant nurses. Now, many times people that are operating room nurses come to me and they take my courses and they get a job in utilization review when their whole career was operating room, or OR circulating, and we can get them and help them to get into different types of utilization review or case management. Our OB nurses, I have lots of OB and NICU that come to me, and I'll say, look, I can help you, but you are in a very specialized area of maternal health and OB. So about maybe 30% of the jobs will accept you, either for OB and ICU, or they might train you in, like we teach a lot of medical, surgical, and orthopedic utilization review. So they might actually put you in that area since you had some of that training, even though you're OB. So I mean, we can help almost anyone get into this, but of course, some of the nurses are going to have more opportunities than others, depending on what their clinical background is.
Sure. That's encouraging to hear that it's overall helping most specialties, and that people aren't.
Yeah, I mean, really, everybody gets sick and needs a service. So, they could be just a little bit sick or very, very seriously acutely ill with specialized, problems.
Yeah.